Okay, this is only a short video for how to want to show how uterine inversion happen. Supposing this is a uterus, okay. So this is going to be the cord. Okay, supposing this is going to be the cord inside. So when you pull the cord not properly and with the force, then what happens is along with the cord, this is going to be the inside, this is going to be the outside uterus. So this cord will be going to pull the uterus inside out. So this is going to be like that. So this is going to be like that, and then you can see the endometrium. This is endometrium, and then supposing this is going to be the placenta attached. So this is what you call uterine inversion. So, and then this is the fundus. Obviously, this is the fundus of the uterus. So when you see on the abdomen will be, this is the abdomen, supposing, then supposed to be the fundus, supposed to be the round and hard at the umbilicus level. But when you are talking about uterine inversion, there will be the dimpling. That means that this is going to be the dimple sign here, the flattening of the uterine fundus, and that is one of the signs in the abdomen to see that it's uterine inversion. And then you can see the fleshy surface area attached to the placenta. So that is your uterus fundus, endometrium. Then patient might have the maternal collapse. Rarely, even though it is under the, it can cause a BPH, but rarely it will cause BPH if the placenta is attached. If the placenta is partially separated, then yes, it may cause a BPH because uterus cannot be contracted, so you might end up with a BPH. But if placenta is totally attached to the endometrium, sometimes if the placenta is at the fundus, so that when you pull, it will cause an inversion. Sometimes it is a short umbilical cord, it will cause a uterine inversion. So when it causes, you will see that like that. So if it is in a normal delivery, when you see the uterine inversion, you must straight away put the one which is inverted. You have to push it back into the maternal through the cervix to the endometrium and to the uterine cavity back before the uterus start contracting. Then after that, you have to massage and then give the oxytocin 40 unit infusion. Supposing if you try to, and then you need to call for help for the senior obstetrician. If you are the one junior doctor who is delivering the patient, then you have to call for senior and you need to do it. A patient should be given the anesthesia, either the mattress outside or betadine. Otherwise, you will be having pain. If this one is not, if you are not able to reduce the uterus back to the uterine cavity, then you need to go to the operation theater. You have to do the surgical procedure to put the uterus back to the normal condition. Also, not only the vaginal delivery, during the operation theater and cesarean session, the uterine inversion might happen as well. So when there is a uterine inversion happen, straight away you have to push the inverted uterus part in the normal condition. Then you make sure uterus is massaged and uterus is contracted. IV oxytocin infusion 40 unit has to be running on. Then only you are not going to have the BPH. So if this happens, if a mother is collapsed, first of all you need to resuscitate. Of course, call for help, resuscitate the patient, and at the same time you need to push the uterus back into the maternal, the abdominal pelvic cavity. Then you can antibiotic is not necessarily, it's not essential to be given, but the main thing is that you must make sure the resuscitation. If there is a BPH, you have to do the BPH management. After you put the uterus back into the uterine cavity, then only you deliver the placenta. If the placenta is halfway, they don't deliver the placenta first. Make sure uterus has to be back to the normal condition, normal position, then only you deliver the placenta. If the placenta is not separated, it's morbidly adhered, then you have to deliver by the MRP in the operation theater. This one, the uterine inversion, if it is happened in a normal delivery, you can do it in a labor room. If the placenta is retained after the uterus is back to normal condition, then you have to go for MRP in an operation theater. Okay, that's all.